Medicare Part D is changing in 2026. And one of these key changes is the amount you're going to have to pay for that out-of-pocket maximum. So today we're going to look at what these changes are, how it's going to impact your prescription costs, and how you can plan ahead. In this video, we're going to talk about the two key changes that are coming to Part D drug plans for 2026. We'll also review the different components of these drug plans and exactly how they work. We'll talk about the different ways that you can get drug coverage and why do you even need a Part D drug plan if you're not on any medications. So first of all, let's talk about the two changes that are coming to these Part D plans for 2026. So the first one is the deductible is going to change on these plans. So right now in 2025, these plans can have no higher than a $590 deductible. Now, there's different tiers of medications. They go all the way from Tier 1 up to Tier 5. Tier 1 and Tier 2 are usually those preferred generic and those generic medications. So usually the generic medications and Tier 1 and Tier 2 don't apply to this deductible. But when you get into the brand name medications, if your drug plan has a deductible, and again, it can be up to $590, that means you would have to pay out of pocket for the first $590 for those brand medications before the insurance would start paying, okay? Now this is going in 2026 from $590 up to $615. So $615 will be the new max deductible that a Part D drug plan can have. This is about a $25 increase. So for those of you out there who are on those brand name medications who do have to pay that deductible each calendar year, just know that's going up to $615. Now the catastrophic cap, so we're going to talk about the three phases of these drug plans, but when you hit the catastrophic level, everything else is covered for the rest of the year. So right now in 2025, this cap has been $2,000. Which is fantastic because a lot of you out there who are on very expensive medications that are $5,000, $8,000, $10,000, even $13,000 a month, the way this works is once you've paid $2,000 out of your own pocket, you hit the catastrophic cap, and that's the most you'll pay in a calendar year for your medications. And then it kicks in, the insurance, and you don't have to pay anything else the rest of the calendar year. Now this is going, not a huge increase, but it's going from $2,000 to $2,100 in 2026. So that's a $100 increase, okay, on that catastrophic cap. So these are the two main changes, but let's look kind of at these different parts, the deductible, the initial, and the catastrophic phases, and how these drug plans work. All right, so let's look at the three phases of all Part D plans and how they work and who pays what. Okay, so first we have the deductible phase. This is called the deductible phase. And remember, this year in 2025, it was $590. Now in 2026, it's going to go up to $615. Okay, so what this means in the deductible phase, this year the patient pays 100% up to this amount, which in this year is $590. Next year it'll be $615. Now remember, Tier 1 and Tier 2 drugs, which are preferred generics and generics, are usually exempt from this. So let's say you're on a Tenolol or like losartan, a very common, generic medication that a lot of people are on. You're not going to pay anything for those. You're going to pay probably $0, $5, very low, depending on your plan. Those won't count towards the deductible. But remember, if you're in those Tier 3, 4, or 5 medications, you would have to pay that deductible. So when you're paying up until that amount, that's called the deductible phase. Now, secondly, after you've met that amount, we're going to get into the initial coverage phase. So for this year, it'd be $591 right after that. Next year, it'll be $616 right after the deductible phase, all the way up to $2,000. So this initial coverage phase is going to be in the middle, okay? It's going to go all the way from the deductible up to $2,000. So let's look at the split of the payers once we hit the initial coverage phase. So the patient at this point is going to pay 25%. okay? So if you're on a brand name medication, you're going to have to pay more for that the first month or two, or however long it takes to hit your deductible, and then you'll see it will get less expensive for you because now you're going to move to the initial coverage phase and you're only paying 25% for that medication. Now, who's picking up the other part of it? Well, if it's a generic plan, a generic drug, the Part D plan is going to pay the other 75%. Okay. Now, if it's a brand name drug, the plan's going to pay the other 65%, and then Medicare kicks in the extra 10%. Okay. So you see, we have multiple payers once we start to get into that initial coverage phase. Now, we're in that phase until we hit $2,000. Now, remember, that was for 2025 this year. For next year, it's going to be $2,100. Once you hit $2,100 next year, then we're in the catastrophic phase. And that's good news for you as the patient, because that means now you as a patient pay 0%. Once you hit that $2,000 this year, or the $2,100 next year, all your medications are going to be covered as long as they're on formulary for the rest of the year, okay? Now, the Part D plan is going to pick up 60% of that, so the plan will pay 60%. Medicare will pay 20%, and this is where the manufacturer comes in. The manufacturer is going to pay the other 20%. So those payers, the plan, Medicare, and the manufacturer, are together paying 100%, so you don't pay anything at all for those medications. So this will not change. These are the 3 phases of all Part D plans. Now, the other thing that could change year to year are the formularies. So the formularies of these different Part D drug plans, or if you have an Advantage plan, again, that Part D plan is encased in that drug plan, that Advantage plan. So the formularies could change. So what's a formulary? All a formulary is a list of approved medications, okay? So it's going to be very important to make sure if your plan is changing this fall that you get on a new Part D drug plan or a new Advantage plan where your medications are going to be covered. Now, sometimes you could do what's called a formulary exception, and if all of a sudden your medication is no longer on the formulary, you could see if your doctor could write a request or a letter to the carrier. More than often, they will approve this to make a formulary exception for you to get that medication covered. Now, if you can't get it covered, we send people to some outside resources. One is GoodRx. You may be able to get a discount code and get help with the medication from GoodRx. Another one is called Cost Plus Drugs. I believe Mark Cuban owns that, and there's some good pricing on medications there, because sometimes people ask, well, what do I do if my medication's not on formulary or if it's not covered? So there are some other cost-saving measures you can use. Just because you have a Part D plan doesn't mean you have to pay full price and use your Part D plan for that. You do have other options like the GoodRx or Cost Plus Drugs. So what are some of the different ways to get drug coverage? So again, if you're with a large employer or an employer plan and you have creditable drug coverage through that plan, then you don't have to worry about a Part D plan. You can keep working and get your prescription coverage through your employer. But outside of that, if you have a supplemental plan, like a G or an N plan, and you just have original, or if you just have original Medicare, you're going to get a standalone PDP plan, okay? So a standalone drug plan. Now, if you have an Advantage plan, a lot of times we call these MAPDs because they're Medicare Advantage prescription drug plans. You're going to have that RX coverage included. So if you have an Advantage plan, the drug coverage is included. You're not going to need a standalone drug plan. Now, there is a select few of you that are going to have creditable drug coverage from another source, and you would be able to get what's called a MA-only plan, okay? So this is only a Medicare Advantage plan because you don't need the Part D prescription coverage because you're getting that from another creditable source. So creditable drug coverage means that it's as good as, if not better, than what the Part D plans are offering. So you may have this if you have VA benefits, so through the VA, also if you have TRICARE or TRICARE for Life, which is retired military, okay? If you have medication coverage through there, that's great. You're not going to have a Part D drug plan. Or if you have FEHB, which is federal retired employees, government employees. So government employees as well can get their drug coverage through FEHB. So you guys could get what's called a MA only plan, and sometimes this is a nice perk because it gives you the flexibility. Maybe you don't want to see doctors on base, you want to go outside of that system, you can see some other doctors, and you're going to get some of those perks like the free gym membership, the dental, the hearing, the vision, but you don't need the drug coverage. So a lot of times they'll offer something called a Part B give back, and because you're not using their drug coverage, you don't need the drug coverage, it'll give you a little bit kickback money towards your Part B Medicare premium. And these may be as low as $3 to $5, but I've seen them as high as $150 to $175. And it's great because it credits to your Social Security check and gives you a credit towards your Part B premium. Now, what if you're turning 65 or you're retiring and you're enrolling in Medicare and you think, I'm not on any medications. Why do I have to sign up for a Part D drug plan? Well, there's a couple reasons. First of all, you never know what can happen, right? There's no crystal ball with health. What if you are prescribed an expensive medication by your doctor and you don't have drug coverage? Some of these medications can range anywhere from $5,000 to $13,000 a month and can be very, very expensive. So you don't want to get caught where you need a medication and you can't have coverage. Now, it's important to know if you don't sign up for one of these drug plans when you first, enroll in Part B and set up your Advantage or your supplemental plan, you can't just add one at any time. You could be locked out to a certain enrollment period, which is called annual enrollment period, which is from October 15th through December 7th before you could sign up for drug coverage. And that's not going to go into effect and kick in until January 1st of the next year. So you would never want to get caught where you need an expensive medication and you've got to pay for it out of pocket because you don't have any Part D coverage. Okay. Now the other reason is because of penalties and fees. So you have 63 days to get your drug coverage set up when you enroll in Medicare if you don't have other creditable drug coverage. And after 63 days, they're going to penalize you 1% per month. So every month that you go without creditable drug coverage. Now, the 1% is going to be based on the national premium price for a Part D plan. So this year for a Part D plan, I think the average price is around $35. It's like $34 and some odd cents. So around $35. So it doesn't sound like a huge amount, 1%, but if you go 2 or 3 years, let's say you go 3 years without any creditable drug coverage or a Part D plan, that's a 36% penalty that you could get, and that's 36% of the average premium of a drug rate for that year, and that's going to be a lifetime penalty. So when you do go get drug coverage, you're going to have to pay that much more every month because you have a penalty. So it is important, even if you're healthy and you think you don't need it because you don't have any medications now, it's still good to have the coverage to avoid any late fees, penalties, or being locked out of enrolling if you do need it. Again, we're here at Medicare School to educate you. Here's what you want to make sure. If you call us and work with us, or if you work with someone else, you need to make sure they're always talking to you about what kind of medications you're taking, what doses you're on, to make sure they match you up with the best drug plan. Remember, if you go the supplemental route or original Medicare, you have to have a standalone Part D drug plan. If you go the Advantage route, it's going to have that prescription Part D included, but you still want to make sure you know that your medications are on formulary and you're picking the right plan for you.